More cities in Arizona joined the state and federal government this week in declaring emergencies over COVID-19. Most notably, the mayors of Tucson and Phoenix announced restrictions on dine-in restaurants, bars, and gyms.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
With every declaration come varying stipulations as longtime establishments shuttered their doors.
It's just a big question as to how long this will last.
Schools across the state also canceled class.
I encourage people to go to your neighbors and try to do some kid sharing.
And our nation's borders became more exclusive.
Canada and the United States will temporarily restrict all non-essential travel.
Steps taken in an effort to slow the spread of the novel coronavirus.
We're not guessing. We're being guided by data, facts, and science.
For a better understanding of the government's response so far, we got insight from Dr. Richard Carmona, former U.S. Surgeon General during the Bush administration, who served during the SARS outbreak in 2003. In a public health crisis like this one, who should be calling the shots? I mean, we're hearing things from the state, local, and federal authorities.
I think we all have a role and a responsibility. I think the federal government can set the tone for the United States, but each state is different. How the disease is expressed in each community is different. So we apply the same public health science, but it may be a little different in each community. Whereas hand washing and social distancing is the same in different communities. Where you see clusters of diseases, you might take more aggressive moves more quickly at that point. So there's where you see the differences across the United States.
Here in Tucson, for example, a local emergency was just declared, but last week a state emergency was declared. It seems like there's a lot of finger pointing going on. What should the public make of all this back and forth?
Well, I think the public, what we need to do is to reassure the public that there are systems in place to protect us when issues like this occur. The governor's looking through a different lens, a state of 7 or 8 million people, scattered over hundreds of thousands of miles. The city of Tucson is much smaller, and they're looking at a different microcosm. So it's not one is right and one is wrong, but the governor may pull the trigger a little earlier because if he declares an emergency, it allows him to free up funds to do more. It allows him maybe to move the National Guard someplace to assist. So there are reasons sometimes that happens.
All right, you were Surgeon General during SARS in 2003. Yes. What can we take from what we learned then and apply it now? Are there any parallels to draw?
Well, the first parallel is the SARS is a coronavirus, okay? And viruses act similar, except the virus we're dealing with now is a, a mutation. So what that means is the genetic fingerprint changed, and so it expresses itself a little bit differently. So whereas we can say it might act a little like the coronaviruses, since it's new, we don't know exactly what it's going to do, but we do know since people haven't been exposed to it, it is a potential problem because you don't have any immunity. And those people who are immunosuppressed, who have cancer, who have AIDS, who are taking drugs that will suppress their immune system are at higher risk. For most of us, this will be a common cold, or maybe a little sicker than a common cold, but you'll probably do okay with it. But the vulnerable populations are the ones that we're most concerned with now.
If you could take something from what you learned then and apply it now, what would it be?
The most important thing, and we learned that in SARS, but we learned it during Katrina, tsunamis, and a whole host of other emergencies, is you have to learn to inform the public and not inflame the public. Make sure that there are good science-based information provided to the public so that they can make good decisions. Make sure that the person speaking is a person of credible authority in the area so that the public feels, okay, this is the right person to be speaking to me. And then make sure that the public understands that in a challenge like this, we will continue to evolve on a daily basis as we get new information about what the virus is doing, how many people are sick, what city is it in now, where is it moving to. And because of that, in public health, we'll take different steps. And it's not that we're changing our mind, it's just that we understand this is an evolving threat.
When the public sees the president, the governor, the mayor on the news, the media, it's wall-to-wall coverage, it's natural for the public to worry and wonder what's happening out there. So what should they make of all the messaging?
Well, I think all of the messaging that I've seen is well meant. The problem is sometimes it's conflicting, and you have one official saying something, another official says something else. Somebody says, let's do 50 feet, let's do 25 feet, let's do spaces of so much. And the public goes, well, which one should I do? When we make those changes, we owe it to the public to have them understand why we're being more restrictive. We're seeing more disease, so we want to separate the space between you and somebody else. We want to decrease the amount of people in an open space because the more crowded it is, the more likely we'll transmit the virus. So it's not that they're wrong. Well-intentioned people are all talking at different times, and the public is, well, who do I believe? It's up to us to communicate effectively in a health-literate, culturally competent manner because our communities are so diverse. We have to be able to understand and communicate at their level. This is really complicated science. For the most part, the average person is scared. They're scared of the uncertainty, and sometimes the uncertainty can be more toxic than the disease itself because of the fear and uncertainty.
In your professional opinion, given the risk, given what we know now, is the United States, locally here in Arizona, are we taking the appropriate steps?
We are. I do believe so. We have a system in place called the National Response Framework that we worked on decade and a half ago, after 9/11 and after Katrina. Because we realized then that we have to be able to surge at a moment's notice, that different organizations have to be able to work together, and it's essentially an incident command system like fire and police use today, but ability to use it at a big scale, at a national scale. So we have that here, and we're scaling up now. You hear the questions. How many beds do we have? Do we need to have some pop-up hospitals to take care of people? How do we screen them differently? That's not being reinvented today. All of that is in the playbook as to how we do what we call all hazards. And coronavirus is one of those all hazards which we put under the umbrella of emerging infections. And we see them all the time. This one happens to be problematic.
Okay, and some promise that better days are ahead.
Yes, of course.
Okay, Dr. Carmona, thank you.
Well, thank you, Lorraine.